Can breast cancer impact your heart disease risk? Stick around to find out because in this video, your favorite cardiology nurse practitioner is going to break it down for you. But first, hello everyone, my name is Ray and I'm a hospital-based nurse practitioner who specializes in cardiovascular disease. If you're new to the channel, welcome. If you're not new, welcome back. In this channel, we talk about heart disease, both prevention and treatment, other topics related to the heart, and overall health and wellness. So if that sounds good to you, let's get started. If you know someone with left-sided breast cancer, and yes, men get breast cancer too, by the way, please do me a favor and share this with them. So I recently had a patient that came in after passing out or having what we call in the medical community a syncopal episode. Syncope, by the way, is defined as an abrupt, transient, complete loss of consciousness with rapid and spontaneous recovery. By the way, I recently uploaded a video about syncope. I will link it to this video so you can check that video out too. So my patient came in after passing out, and when I talked to her, she denied any family history of heart disease. She did not have many risk factors for heart disease, such as diabetes, hypertension or high blood pressure, hyperlipidemia or high cholesterol. She wasn't a smoker. She had never had a syncopal episode before and didn't really have much medical history other than that she recently got diagnosed with left breast cancer. She was not on chemotherapy, however, she had been getting radiation therapy. In this video, I'll be talking about something called cancer therapy related cardiac dysfunction or CTR-CD. Now, I'll get to the radiation part in a second, but first, I did want to talk a little bit about how chemotherapy can affect your heart. Chemotherapy can cause significant cardiovascular toxicity, most commonly, and we've known this for many years, manifesting as what we call a cardiomyopathy and also heart failure. The most frequent agents that are implicated are medications called anthracyclines and HER2 targeted therapies. Anthracyclines, by the way, the most commonly used one is a medication called doxorubicin. When I worked in interventional radiology, we used to do a procedure where we would inject this medication directly into the tumor of a liver and cut off its blood supply. It's called a transarterial chemoembolization or TACE. But yeah, these anthracyclines can cause cardiac dysfunction through multiple mechanisms, including free radical generation, DNA damage, and cardiomyocyte apoptosis. By the way, apoptosis is a highly regulated form of programmed cell death to eliminate damaged, old, or unnecessary cells without triggering inflammation. This sounds like a good thing, however, when it's a result of a medication or treatment side effect, it's actually not a good thing. The cardiotoxicity from these drugs is largely irreversible with myofibrillar loss and cell death. You might be asking yourself, why in the world would we still use these medicines if they can cause so much damage? And that's a good question. And as with everything else we do in medicine, we always have to weigh the benefit versus the risk. And this is why it's so important to see specialists. For example, if you have breast cancer, you'd want to go see a breast cancer specialist or a hematologist/oncologist who has treated a lot of breast cancers and has a lot of experience using those drugs and therapies. You wouldn't take your car to your dentist, right? No, of course not. You'd take your car to the mechanic. So make sure you go to an expert. Monitoring for these chemotherapy-induced cardiotoxicity involves getting a baseline echocardiogram, including something called a global longitudinal strain or GLS. GLS can detect subclinical dysfunction earlier than the left ventricular ejection fraction can, but a reduction in the ejection fraction of greater than or equal to 10% is considered significant. It's important to get an echo at baseline and then 6 to 12 months or so after completion of anthracyclines. But with HER2 therapies, an echo every 3 months may be recommended. Now, besides drug toxicities, other breast cancer treatments, such as radiation, can also cause adverse effects on the heart. And this is why I wanted to upload this video. My patient that came in did not know about the potential that radiation can cause to the heart. According to the New England Journal of Medicine, radiation can cause myocardial ischemia, or lack of blood flow to the heart, pericarditis, which is inflammation of the pericardium. The pericardium, by the way, is a protective sac around the heart. Radiation can also cause myocarditis, which is inflammation of the heart muscle itself, and radiation can also cause valvular heart disease and even arrhythmias such as atrial fibrillation. Coronary artery disease, which means blockages in the arteries of the heart, is the most common manifestation of radiation-induced cardiovascular disease, and it can occur in up to 85% of exposed patients. The risk begins within the first 5 years post-radiation and continues into the third decade. The studies were based on older radiation techniques, and there have been some advances that may reduce cardiovascular complications, but it's still something to be noted. So as you can see, radiation is not as benign as once believed. For patients that have experienced cancer therapy-related cardiac dysfunction, they should be referred to a cardiologist or cardio-oncologist specialist. These patients will likely be placed on what we call guideline-directed medical therapy, which includes certain classes of medications such as beta blockers like metoprolol and ACE inhibitors like enalapril or ARBs such as losartan, along with a medication called spironolactone, which is a diuretic, as well as also a statin. These medications may not necessarily be for what their intended purpose is. Like for most of these medications, are blood pressure medications, and then a statin is for cholesterol, but we use them because of how they help protect the heart from other adverse effects from the cancer-related treatments. There's also new evidence, according to a 2025 meta-analysis showing promise that Jardiance, which is a very common diabetes medication, as well as a medication that we use for heart failure, was associated with a 48% reduction in cancer therapy-related cardiac dysfunction. Some of my viewers gave me some feedback telling me to keep medical terms to a minimum, so I won't go into too much detail, but suffice it to say that between your cardiologist and your oncologist, they will work together collaboratively to ensure that you're on the right track. So, if you've made it this far, I want to thank you for spending your time with me today. Time is one of our most precious gifts we can give, and it's finite, so thank you for sharing yours with me today. If you have any questions about this or any video, please feel free to leave me a comment. I read and answer them all, and I look forward to an engaging community. By the way, to the person who commented saying thanks for starting this channel and saying that it's really helping you, you have no idea the impact that one comment had on me. So from the bottom of my heart, thank you for letting me know that this channel means something to you. If you found this video to be helpful or informative, please let YouTube know by subscribing to the channel, and make sure you turn on your notifications so you'll never miss when I upload a new video. I want to say a big, huge thanks to all of the current subscribers, all 391 of you. Y'all are really motivating me to continue to do this work and make content that helps others. Please consider sharing this with the people you love in your life. Together we can decrease the burden of heart disease one video at a time. While you're here, please consider checking out some of my other videos, like what Big Pharma doesn't want you to know about diabetes. I have a video about hormone replacement therapy and how it impacts heart disease, a video about GLP-1s like Ozempic and Wegovy. I have a video about how to count calories and how to get started with fasting, so make sure you guys go check those out too. I hope to see you in the next video. God bless you.